Good evening, my dear Rovers, dear Scouts, and all of you joined with us today. Warmly welcome you to the next episode of Pioneers of Tomorrow online webinar series brought to you by Ethugalpura Pioneers District Rover Group. Risk may be anywhere. Accidents could occur anytime. At the next blink of eye, it may be someone you know who face such a hazardous situation. It may be one of your beloved ones who face an emergency life-threatening health condition. At that time, the need of a competent first aider becomes crucial. So as scouts, we should be prepared. We should be competent enough in order to do correct first aid maneuvers and rescue his or her life. So in today's webinar, we are focusing on basic first aid skills that everybody should learn as a life-saving skill. Let me introduce tonight's speaker, Mr. Yasantha Lokuhelapitiya, who is a Senior First-Aid Instructor at Sri Lanka Red-Cross Society. Beforehand we commence today's session, I have a few brief announcements for the audience. If you encounter any doubts, if you have any queries, there will be a Slido link which is posted in the chat box. So please go to the Slido link and post your questions there. At the end, we will bring those questions and we will try to provide answers for your questions. And also, we are providing an e-certificate for all the participants. In order to become eligible for the certificate, please fill the Google form, which is also displayed in the chat box. Without any further delay, let's move to tonight's session. Dear sir, the floor is yours.
Okay, good evening, everyone. And first of all, I would like to convey my sincere gratitude to Ethugalpura Pioneers for inviting me to conduct this first aid training program. And I am Yasantha Lokuhelapitiya representing the Sri Lanka Red-Cross Society. And of course, today we are going to discuss about emergency first aid. It is very important and essential in our day-to-day work as well as other careers as well. So let's directly go to the session. And if you have any questions, so please raise your hand during the session even, or else, as Nadun mentioned, you can send it to the chat box as well. Okay. So if you take about accidental emergencies in Sri Lanka, so annually near 1 million people are admitted to the hospital. And 10,000 out of those admissions, people are dying due to the various injuries. And that is due to it means before the hospitalization. So even after hospitalization, another 4,000 are dying. And as a cumulative value, it is about 14,000. So we are losing 14,000 people due to various injuries. And the sad situation is out of that, 10,000 are due to before the hospital admission. Then we are losing 38 lives due to daily basis due to various injuries. So with that, I would like to emphasize to the importance of first aid, why we should learn first aid, why we should know correct first aid, and what is the importance of applying first aid on right time. So as I mentioned earlier, the annual scenario is the hospitalization is very high, nearly 1 million is happened. Then approximately 38 lives are lost, and 10,000 out of them are dead before hospitalization. So here the most important thing that happens due to the late and improper hospitalization. So due to our road conditions, transportation, we are having the late hospitalization and also the improper hospitalization. So that is the main question we have. Though we are willing to help others, because our people are really, willing to help others, especially in accidents, road accidents especially, but they don't know how to do it correctly. So usually what we do is after an road accident, so we are trying to help the person to stand up, or just, if the person is unable to do that, then we are trying to lift the person and carry to the comfortable position or to the roadside. But that is really incorrect. What we have to do first is we have to check the person for any injury without having any knowledge about the current situation of the current condition of the person. It is really incorrect to move the casualty. So due to this improper hospitalization, we are losing a lot of lives, and we are using three-wheelers for hospitalization most of the time. The other problem occurs here, since we don't aware about any spinal injuries, any severe bone injuries, any severe bleeding, we are placing the person in a three-wheeler and take to the hospital. So sometimes that help will lead to a death or lifetime disability or any other severe injury. So that is the problem. So if we know first aid and if we know right first aid, then we can eliminate or overcome these problems. Okay, if the breathing stops in an emergency, the victim may die within 5 to 10 minutes. In the first 5 to 10 minutes after stopping the breathing, there is a higher chance of dying the victim. So therefore, we should know after breathing, after stopping breathing, what we have to do. What is the correct first aid, that is CPR, we are going to learn about today. Then time taken to transport the patient varies from 10 to 60 minutes in Sri Lanka. So that is the other important thing. Since we are taking considerable time to transport a person to the hospital, then it is very important to apply right first aid during the hospitalization. If you are unable to stop a severe bleeding during the hospitalization, then there is no point of hospitalizing the person sometimes. Due to the excessive bleeding, he may have died even during the hospitalization. So this is really important in the scout activities also. This is very important when you are camping and do other various activities. This is really important. So this is, very important to your career as well as your day-to-day life. So hope will get the maximum out of the content that we are going to discuss today. Then I would like to ask few questions. So if you are willing, then you can raise your hand and answer one or two, or else you can answer to yourself and check whether you are correct or not. So there are a few statements, and what you have to do is you have to just see whether the statement is true or false. The first thing is, after an accident, immediately move the victim to a comfortable position. So the statement says, after an accident, without doing any other thing, what we have to do is we have to immediately move the victim to a comfortable position. So is that the first thing that we have to do? So anyone answer? So anyone who is willing to answer the question? Right, this is false. Because after an accident, what we really have to do is we have to assess the casualty, or assess the victim. After having a good assessment only, we are deciding what to do. But if the casualty is still in danger, then what we have to do is we have to assure his safety, and we have to move the casualty if we have to rescue him from further danger. Otherwise, we are not going to move the casualty. So the statement is false. After an accident, immediately we are not going to move the casualty to a comfortable position. If the casualty is okay, then we are not going to move the casualty. If there is no danger, then we are not going to move the casualty. We are doing the first aid as it. Then the second one, if a person is burned, then use a toothpaste. So are we going to apply toothpaste for burn wound? As a local practice, we are doing this and we are applying so many other things as well. But according to first aid, this is not correct, because when we are applying toothpaste, there is a chance of getting infections as well. So therefore, the statement is false. It is not correct to apply toothpaste for a burn wound. Okay. The third one is unconscious casualties may die due to blocking of the air. So due to the blocking of the airway, unconscious casualties may die. So let's see what happens in unconscious situation. So when we are not conscious, we can't move our body as we wish. So the involuntary movements are not happening when we are unconscious. And especially a person is unconscious and collapsed on the floor, actually by his own tongue, his airway is blocked. Though the person is able to breathe in and enough oxygen is there in the outside environment, but there's a problem because the tongue is blocking the airway from our throat or pharynx. Since it is blocked from the throat, there is no way for the oxygen to go inside the lung. Then there is a chance of blocking the airway in unconscious casualties when they are correct. So this statement is true. Then the final one, there is no any chance of preserving the life of a casualty if the casualty is not breathed. There is no any chance of preserving life of a casualty if the casualty is not breathed. So if there is no any chance, then there is no point of learning first aid as well. Because if we can't help a non-breathing casualty, then there is no point of learning first aid. But we can, because by giving chest compressions and rescue breathing, we can help or we can try out to establish the breathing of a non-breathing casualty. So therefore, this statement is also false. There is a way that we can try out to re-establish the breathing of a non-breathing casualty. So this is only to brush up your knowledge for get entered to the course. And if you need anything to be clarified, also please raise your hand, or else you can send it to the chat box. So since we have a limited number of time, I have a great challenge of completing the most important topic as we agreed. So I have to go a little bit fast, but I will try to clarify those facts as much as possible. So what is first aid? So the word itself says the first aid, the immediate assistance that is given by a qualified first aid. So here what we have to really think about is who is going to give first aid, when first aid should be administered, then how it is administered. So a person who is qualified in first aid, then first aid is given in injuries and illness. But those are sudden injuries and sudden illness. So for the accident, we should apply first aid. And sudden illnesses also, we have to apply first aid. Not for the persistent. For the chronic illnesses, we are not going to apply first aid, but for the sudden injuries and sudden illnesses, we are going to apply first aid. Then what we have to use? So the suitable resources that is available in the environment, we have to use. The other. So as first aiders, we don't know at what time an accident is occurred. So where it is occurred, at what time it is occurred, we don't know anything about that. Without prior information it happens. So therefore we can't have any sophisticated equipment for apply first aid. In that case, we have to use what is available in the surrounding, and that should be appropriate enough to use for that particular treatment. And this is also very important. This is only a temporary assistance that we are giving until the patient is handed over to the medical facility. It means to a doctor, to a hospital, or to an ambulance. So this is only a temporary assistance, but this could be the life-saving action for that person as well. So therefore, this is very important, but we have to know about our limits as well. So in our life, actually, we do have different aims, objectives, goals. Likewise, in first aid also, we have different aims. There are 3 aims in first aid: preserve life of a casualty, then limit worsening of the condition, then promote recovery. So we'll discuss how we can achieve these objectives of A. So in order to preserve the life of a casualty, what we can do is we have to assess the vital signs. Here vital signs means breathing and pulse. The other thing is checking whether the person is conscious or not. So checking the person's consciousness to understand whether he is conscious or not, and checking whether he is breathing or not. So those are to preserve the life of the casualty that we are going to assess the vital signs. Then airway management. If an unconscious casualty is collapsed and the airway is blocked by the tongue, then what we have to do is we have to open the airway. So otherwise, his breathing will stop and gradually he will become dead. Then, since he is dying gradually, what we have to do is we have to open the airway. So therefore, by airway management, we can preserve the life of a casualty. Then, by giving rescue breathing and chest compression, we can re-establish the breathing of a non-breathing casualty. So we can try to re-establish the breathing of a non-breathing casualty by giving rescue breathing and chest compression. Then, by controlled bleeding, actually, we can save a life of a person. You may have heard that due to excessive bleeding, this death has happened. As the final report of the investigation, it is claimed that due to excessive bleeding, this death has happened. So we can avoid that by control the severe bleeding and transport quickly to the hospital. Then we can preserve the life of a casualty. Then how we can limit worsening of the condition? By examining the casualty and make a proper diagnosis, we can understand what is the current situation. Then we can act according to the situation and we can prevent the condition getting worse. Then give priority to serious injury. After proper assessment, proper diagnosis, we can identify who are the most serious people. According to the severity of the illness, we have to do the prioritization and we have to treat accordingly. Then treat multiple injuries in order of priority as we discussed earlier, and immobilization of bone injuries, poison situation, and other injuries as well. So immobilizing in a bone injury will help the person to avoid the serious fracture, sometimes the serious surgery as well. So immobilizing that we can prevent even a spinal injury sometimes. So a lifelong disability or lifelong paralysis can be prevented by immobilization of a bone injury, and also immobilization of poisonous situation will help the person to stop the spreading of the venom or the poisonous substance all over the body. So that also limit the worsening of the condition. Then the third one is promote recovery. So how we can promote recovery is relieving the discomfort of the person or the victim. Then we can relieve pain and anxiety as well. So we can make him calm and we can make him comfortable. Then reassuring the casualty. We can help physiologically as well as we should help him psychologically as well. When the person is calm, then we can, it is really good, or it is really, capable of making him a fast recovery. So if the person is calm, his circulation is normal, become normal, then bleeding will reduce, as well as if he is heart patient, his condition will get worse, not get better. Then if he is poisoned one, then therefore also the condition is getting better when after the reassuring and making him comfortable. Then get medical aid as soon as possible. We can take him to a doctor or to a hospital, or else we can handle him over to an ambulance. So likewise, we can get the medical aid and promote the recovery as well. Then what are the good qualities of a first aid? So the first thing is knowledge of first aid. That is an essential component. We should have a proper knowledge on first aid. Apart from that, there are certain qualities mentioned here that should be, better to have to become a good first aider. So number one is patience. There could be a lot of problems from the victims as well as from the bystanders when we are going to apply for state. So we should have the patience. Then kindness. It is very important to be kind for victims when we are applying for state. Then not to reject and no discrimination depend on the gender, our religion or race. There shouldn't be any discrimination based on that. Then self-strength and self-confidence. We should be confident enough about ourselves whether we can deliver this first aid or not. If we are going to give CPR, then we should confident enough. We should have enough confidence about ourselves that we are capable of doing this. Then leadership. So this is very important in a large scale accident. So when there are multiple casualties or when an accident happens, especially in a very public area, then there are a lot of people who are trying to control this situation. Though they don't know first aid, they are trying to help people, but in incorrect way. So in these kind of situations, what we have to do is gradually we have to take the leadership for ourselves. So we can't say that just going to that place, I am so I know first aid, I am a good first aider, so I am the leader here, I am going to give first aid. Likewise, we can't get the leadership like that. So what we have to do is there are people who are taking the leadership there, but if they don't know first aid, if they are not aware of first aid, then you have to give them the other responsibility, like calling for an ambulance. Manipulating the traffic in that particular area. Likewise, you have to give other responsibilities for those people, and you can take the leadership of investigating or assessing the people or the victim. Then you can do a better job with the good leadership. Then act according to the situation. Though we discussed a lot of theories here, in practical situations, one person can have a lot of injuries, and also there could be multiple victims as well. So when the condition is not favor or not exactly match with the theoretical condition, what we have to do is we have to think and analyze that particular condition, and we have to take decisions according to that. So therefore, we must act according to the situation. Then not to get excited. We should not get excited. We should be very calm, but we should be very alert as well. If we are also get excited, then there is no one to help in the right way. And prompt action. We should deliver a prompt action as well. Right. So, so far we discussed about the prioritization of casualties. We said that it is very important to prioritize the casualties. So there are 4 situations. So if we have these 4 situations, all 4 types of these casualties are really in danger. They are in very severe condition. But out of these 4 situations also, we can make a priority. So if there is only one first aider and if there are 4 casualties, then that first aider can attend only one casualty at a time. So the first aider should think or have to analyze to whom am I going to attend first. So out of these severe bleeding, unconscious, not breathing, and poison, what we have to analyze is who is more tend to die. So who is having the more serious situation. So number 1 is the non-breathing casualty. Since he is already stopped breathing, there is a high chance of dying within 5 to 10 minutes. So therefore, we have to approach the non-breathing casualty first. Then the other thing, severe bleeding casualty. So when the casualty is having a severe bleeding, what we have to do is we have to stop that bleed. Otherwise, within few minutes, he will not have the sufficient volume of blood to circulate oxygen. Then his heart will stop and the brain is also not functioning because the heart can't pump sufficient glucose and oxygen to the brain. So he is also may become non-breathing within few minutes. So it is very important to approach the severe bleeding as the second priority. Then third one is unconscious casualty. So as I told you earlier, an unconscious casualty may become non-breathing due to the obstruction of the airway by his own tongue. Therefore, what we have to do is we have to attend that unconscious casualty at our earliest as the third priority. Then number 4 are poison casualties. If the poison substance spread all over the body, especially in the vital organs like brain, heart, lungs, kidneys, then liver, then there will be a lot of complications. And it will be a severe life-threatening condition as well. So therefore, we have to attend those poison people as much as possible as the fourth priority. Then as the fifth priority, it will be severe burns, and the other accidents and injuries become after that. So like small fractures, small cut injuries, those are coming after that. Painting like things, those are comparatively mild situations or minor injuries. These are the most severe and should be prioritized when there are multiple casualties. Okay. So the next priority, if we have to have an evacuation plan, or if there are few people who are having the same disease condition, minor injuries, but we should think about the priority depend on the other factors of those people. Depend on their tolerability, depend on their immunity, based on their individual nutrition condition. Likewise, we have to decide to whom are we going to attend first if there are multiple casualties with minor injuries, and if there is only one or two first aiders, and also if we have to evacuate the people, to whom are we going to evacuate first in an emergency. So who is very vulnerable here is pregnant mothers, because the baby's life and the mother's life, there are two lives, then they should be addressed first. Then children comes as the second priority here. This is purely based on their individual body condition, how far, how much they can tolerate, then what is their immunity level, then also their nutrition condition like that. Then number 3 will be older people or senior citizens. Then number 4, women, and number 5 is men. So based on their tolerability, we are categorizing or prioritizing these different categories like pregnant mothers, children, older people, and women. Then finally, men. It means women means the ladies, all are younger and elder, both. Then men also, younger and elders, both. So the next thing is we should have a good understanding about the major duties of a first aider when we are going to deliver first aid. So that is incident management. We have to manage that particular incident. It could be a bomb blast, it could be a huge fire. Likewise, then we have to have the incident management as well. Then what we have to do is we have to do the casualty management also. So it means we are going to manage individual victims. So what here today we are really going to discuss is about the casualty management. But since incident management is also important, we are going to just touch that topic. Number 1 is this is known as Amiga process, and number 1 is assess the situation. So what really we have to here assessing is what has happened, where it has happened, how it has happened, then who are affected, and how many are affected. Likewise, we have to assess the situation. What has happened, where it has happened, how it has happened, then whom are affected, how many victims are there. Then number 2 is make the area safe. We have to really make sure the safety of these 3 parties. Number 1 is our own safety. Just keep in your mind, if still the danger is there, without eliminating the danger, we are not going to approach the situation. Because if we also go there and put our life in danger, then there will be, more victims, but there is no one to help. So as a first aider, if you also going to approach the situation and put your life in danger, then there is only victims, but there are no rescuers. So make sure that you have to take care of yourself, and you are making sure the safety of yourself as well as the bystanders, the other people who are in the situation, maybe helpers or the non-affected other people, then victims whom are affected by the injury or illness or disaster happened in that particular time. So we have to make sure the safety of these three parties: first aider safety, bystander safety, then victim safety. So the third thing, emergency first aid. So as the emergency first aid, what we have to do is we have to conduct the primary survey. So primary survey means that we are checking whether the person is conscious or not. If the person is not conscious, then we are checking whether he is breathing or not. So if the person is breathing, then we are turning him to the recovery position since he is unconscious. If the person is non-breathing, we are starting CPR. But if the person is conscious, then we are directly going to the secondary phase. We are talking to the person, victim, then we are asking questions: what has happened, what do you feel now, what are the problems you have. Likewise, we are getting the information from the patient or the victim as well. Then we are conducting the secondary survey, having a deep analysis of the current situation of the casualty. Then treat those with life-threatening conditions first and transport the casualties accordingly. Then as the number 4 step, get help. So we may have to get help of the relevant authorities like ambulances, nearest hospitals, then police, fire brigade, maybe electricity board, water board. Likewise, depend on the situation, we may have to get the different authorities support. So in that case, we should have the contact numbers of those authorities, and we should be able to get the support at the right time as well. Then as the 5th step, what we have to do is we have to do aftermath, especially in camping and the official first aid applications. We have to do that, clean the area, replace the equipment that we have used, then refer the victims or patients accordingly. We may have to refer them sometimes for doctors, sometimes to the hospital. Likewise, then record and report. So it is better to have a record on the patient's condition as well as what we have do or the first aid that we have administered, then what is the current condition of the patient. So likewise, we can have a small record or a report summary as well. So those are the incident management procedures. Then we are directly going to our main topic, that is primary survey. This is vital function. Then we discuss. Then we are talking about secondary survey things and give update other steps. Right. So the primary survey. So the basic life support is known as the DRABC. So there are other names: DRSABC, then DRSABCD. So D is for danger, R is for response, then S is shout for help or seek for help, then A is for airway, B is for breathing, and C is for circulation or compression. Then there is another letter D, that is for defibrillation. So D for danger, R for response, S for shout for help or seek for help, then A for airway, B for breathing, and C for compression, circulation, and D for defibrillation. So that is known as doctors ABCD, and that is the primary survey and the basic life support process. Then how we can make sure the safety of the incident and also the victim. So we have to make sure the safety of rescuer, as we discussed, then victim, then bystander. So there are two things that can be done in this kind of situation. So here you can see an electrocution. So the person is may have connected to that particular electric equipment when he got the shock. Then what we can assume here is there is an electrocution has happened, and what we have to do is we have to rescue the person. So therefore, we can completely cut the power, or else we can remove the person from the wire. So those are the two things that we can do. Number one is cutting off the power, that is eliminating the danger, or we can remove the person from the wire, that is eliminating the victim. So either we have to eliminate the danger from the victim, or we have to eliminate the victim from the danger. Then after making sure the area is safe, what we have to do is we have to check for the response. If there are no signs, visible or audible, if we can't hear anything from the person, and if we can't see any movements from the person, what really we have to do is we have to check response. So therefore, what can we do is while we are approaching the casualty, after make sure the safety, we can talk to the person. Hello, can you hear me? Hello, what has happened? Hello, can you hear me? Are you okay? Likewise, we have to talk to the person. And while we are approaching the casualty, after approaching the casualty, what we have to do is we are further checking the response of the person by knee down from the right side of the person. Usually, if right side is not permitted, then we can knee down from the left side. That is not a problem. So usually we are coming from the right side, knee down from the right side. Then we are tapping the shoulders of the person to make sure that whether he is getting this painful stimuli. So we are tapping the shoulder. So if the person is not responding, then we are concluding that the person is unconscious. Then we have to shout for help. Hello, is there anybody to help me? Somebody come here. Likewise, we have to shout for help. So if whether the arrival of help or not, we are going to continue the primary circuit. So likewise, we are asking different questions, then shout for help, then we are checking breathing. So before checking breathing, what we have to do is we have to open the airway, because as I mentioned earlier, the airway is fully blocked by the tongue. Therefore, what we have to do is we have to open the airway. We are placing one hand on the forehead and placing the two fingers of the other hand under the chin. Then we are tilting the head and lifting the chin. So likewise, we are opening the airway and we are keeping our cheek near the nostrils of the person and check. We are going to check whether the person is breathing or not. So this is how we are going to open the airway. But if you are suspecting any spinal injury, especially the person has fallen from height, then we can suspect any spinal injuries here, any neck injuries, spinal injuries. So what we can do is we can apply a cervical collar here. Then this is how we are going to open the airway of a spinal injured person or any person suspecting for spinal injuries. We are placing our, if we are using both hands, then we are placing our 4 fingers under the neck of the person, then our 2 thumbs on the chin. Likewise, here it is mentioned that we have to place our 2 thumbs here, then the fingers right there. Then we have to lift the chin. So we are slowly lifting the jaw. This is known as the jaw thrust method. The normal method is used known as the head tilt chin lift method. This is the normal method that we are using. But if any susceptible suspected spinal injuries, then what we have to use is jaw thrust method. Even after applying a cervical collar, we can do that. It's better to do like that. So this is how after opening the airway is clear. You can see that the obstruction from the tongue is no more there. So the airway is clear. Then we are going to check for breathing. So likewise, we are checking for breathing for 10 seconds by using 3 methods. We are looking for chest movements. We are listening for breathing noise here. Then we are trying to feel the warmth of the exhale air of that person. So likewise, by look, listen, feel, we are checking for 10 seconds and try to identify whether the person is breathing or not. But due to this COVID situation, we are not going to perform this method as it is. We are only using this look method. We are only looking for the chest movements here without getting so much close to the person, having a proper distance. We are just by look at the chest, we are trying to identify whether the person is breathing on. And also we should wear mask, we should wear gloves, and if it is possible, then it's better to wear an overall as well. So by having our full safety, make sure our safety first, then we can attend those kind of situations, any susceptible COVID situations in these days. Or else what we do is look, listen, feel method. We have to check for 10 seconds and understand whether the person is breathing or not. So these are the breathing rates and pulse rates. For adults, it is 12 to 20 breathing cycles. Then children 20 to 30, infants 25 to 50. So those days actually due to COVID, we are measuring these pulse rate and breathing rate like that using oximeters and other equipment. So make sure and have a good understanding. In children, the figures are little bit higher than the adults. So don't compare with adults figures when we are measuring the taking the measurements in children. So that is misleading. So therefore, we have to identify the correct age gap and we have to know the correct breathing rate and pulse rate in respective age groups. So after checking breathing, we are concluding whether the person is breathing or not. So if the person is breathing, what we have to do is we have to check for any severe bleeding. If there are no bleedings, then we can directly turn the person into the recovery position. So here we are turning the person into the recovery position to make sure that he is having an open air. And also it will help him to avoid any aspiration if we get any vomit. So it will help to avoid any aspiration if the person get vomit during the unconscious period. So this is the unconscious, recovery position. We are doing it to manage the airway is open. Then to avoid the airway is obstructed by vomit. So these are the two reasons why we are turning the person into the recovery position. So you can see here the leg is in L shape. This leg is along with the backbone of the person, and this arm is as in the L shape, and this one is helping the face to not to get any contacts with the floor. So likewise, we are having an open airway here. After turning the person into this position, again we have to check for breathing, whether the person is continuously breathing or not. So this is how we are turning the person into the recovery position. We are placing the right hand first, like this in L shape, then taking the left hand and placing on the cheek of the casualty like this. But we have to continue this support since he is unconscious. If we leave this hand, it will collapse. So we have to continue this support. Then again, we are checking this height to make sure that there are no objects that can harm the person when we are turning the person. Then we are lifting this far knee by using the other hand and slowly turning the person to our side. So after turning the person, we have to make sure that this is in the L shape, and we have to adjust this leg to be along with the backbone. Then two arms should be in this place, and we have to open the airway. So again, we are opening the airway, lifting the chin and tilting the head after turning the person into the recovery position. So after placing like this, we have to definitely check for breathing and make sure that the person is breathing even after turning to the recovery position. So this is the recovery position of the infant. So elders or the adults and children, the same recovery position as we discussed earlier. This is the recovery position. Then for infants, this is the recovery position. We have to really have a good support for the head as well as the back of the infant. So you can see here he is continuously observing to see any changes in the face. Okay, so there are a few instances that we have to understand or keep in our mind. Are we going to turn the people into the recovery position or not? Then do not turn unconscious patients if they have spinal injuries, then if they have any other serious fractures, or if they are suffering from shock. If they have severe bleeding, arrest the bleeding first, then turn into the recovery position. Then turn patients onto their side or into the recovery position, even they are conscious when they are poisoned, when we rescued them from drowning, and when they are adults, then after convulsions due to epilepsy. This means me mesmore apasmare. So after epilepsy, when the person stops convulsions, we have to turn him to the recovery position. Then turn unconscious pregnant ladies into their left side. So that is mandatory. That is should be done all the time. But for other people, even we can turn them to the. Normally we are turning to the right side, but even we can turn them to left side as well. But for pregnant ladies, definitely we are turning to the left side. Then if the person is not breathing, definitely we have to call for an ambulance and we have to immediately start CPR. If the person is breathing, we are turning him to the recovery position. If the person is not breathing, we are starting CPR. So CPR contains two components actually: cardiopulmonary resuscitation, that is, those are chest compressions and rescue breathing. So by giving CPR, what we really expect is to have a continuous blood supply towards brain. If the brain cells start becomes dead, then the person also gradually become dead, and we can't repair the brain cells, so there will be persisting injuries if the brain cells are damaged. Therefore we have to have a continuous blood supply towards brain. That is why we are doing CPR. So as we discussed earlier, there are two components: chest compressions and rescue breathing. So this is how we have to place our hands when we are doing chest compressions. We have to compress the middle of the chest. So this is the chest bone. You can see the middle line of the chest, and this is the nipple line of the chest. So we are placing our hands just above the point that is crossing the middle line as well as nipple line. So if you are, so with your neck, you can here see the chest bone. So this is going down here. Then that line is crossing the nipple line in the middle of the chest. So we have to place our dominant hand on that crossing point. Then after placing if you are right-hander, you can place your right hand. If you are left-hander, place your left hand. So after placing your dominant hand, you have to place your other hand on that by crossing fingers like this. Then don't bend your elbows. Keep your elbows and shoulders straight, and you can start giving compression. So when you are giving compressions, you have to make sure that you are giving compressions at a rate of 100 and 120 per minute. Then you are pressurizing for a depth of 5 to 6 centimeters. It is 1/3 of the chest height of the person. Chest height means the height or the length from the floor to the top of the chest when the person is collapsed. When the person is on the floor, the length from the floor to the top of the chest. So that is the depth. Usually 1/3 of the chest height we are giving the compression. Then after giving 30 compressions, what we have to do is we have to give rescue breathing. Here we have to take a normal breath. We are closing the nostrils of the person. Then we are sealing our mouth to the casualty's mouth, and we are giving a normal breath. So before giving the breath, what we have to do is we have to open the airway of the person as well. So open the airway first, then pinch the nose of the casualty, take a normal breath, place lips over the mouth, your mouth over the casualty's mouth, then blow until the chest rise. So while blowing, you can look for any chest movements. You have to check whether the chest is moving up, whether it is rising or not. If it is rising, it means that your air blow is go inside the patient's lung. Then take about 1 second interval. Then allow the chest to fall. So when you are allowing the chest to fall, you have to release both your hand and mouth from the casualty's mouth and nose. Then again you are giving the second breath. So after giving 2 rescue breaths, again you are giving 30 compressions. So likewise, you have to give 30 compressions, 2 rescue breaths, 32, 32 until the patient is handed over to a doctor, handed over to a hospital, or handed over to an ambulance, or the person start breathing normal. Or the other condition is unless you are so exhausted. Because usually we can perform CPR for 10, 15, 20 minutes maximum. After that, the single person alone can't perform CPR. So that is why we are calling for help when we know that the person is unconscious as well. Then if there is a supporter, if the person is supporter is also know about CPR, then we can have a roster-based system and we can have CPR with the help of the support as well. So there's a small video that shows how blood goes inside the heart.
Without oxygen being passed from the lungs to the bloodstream, then pumped around the body by the heart, you will die. When a person's cardiac arrest, their heart stops beating, they lose consciousness, stop breathing, and blood will not circulate. Unless they receive prompt first aid attention until medical help arrives, they will suffer irreparable brain damage and then die within minutes. In this program, we show the technique that should be employed in performing cardiopulmonary resuscitation only on an adult. We are therefore assuming that you have a general knowledge of first aid principles.
Better to wear gloves as
CPR
well
is a
COVID or
technique
non-COVID
that can
situation.
save lives when performed
So
correctly.
this kind of a face shield is used even in non-COVID situations. So in COVID or non-COVID, if you are going to give rescue breathing, you can use this kind of a face shield, or this will prevent any direct contacts with casualties mouth. And also in COVID period, it is highly advised not to give rescue breathing.
Simply put, CPR is the technique of rescue breathing in conjunction with chest compressions.
So here you can see that heart is squashing or compressing. So this is the chest bone I mentioned. So this is the point that we are giving compression, middle of the chest, and you can see the heart here. These are the two lungs in both sides. So while giving compressions, the heart is compressing and it is squashing and it supply blood towards brain. Then when we are giving rescue breathing, you can see here the lungs are filling.
CPR involves the squashing of the heart between the breastbone and the backbone. This, combined with breathing into the casualty's airway, usually the mouth, can supply oxygen to the lungs and to the circulating blood. Obviously, squashing the heart is the only way a rescuer can keep the heart performing its function of pumping.
So likewise, we have to continue CPR. So when we are giving CPR for infants and children, the procedure is little altered. So normal thing is that 30 compressions and 2 rescue breaths, first 30 compressions, then 2 rescue breaths. But when we are giving CPR for children and infants, we have to start with 5 rescue breaths. So initially we have to give 5 rescue breathing, then we are continuing with 32 lines. So 5 rescue breathing, 30 compressions, then again 2 rescue breathing, 30, 2, 30, 2, 30, we are continuing. At the initial stage only we are giving 5 rescue breathing for infants, children, and as a special case for adults who are rescued from drowning. So who have rescued from drowning, then we are giving 5 rescue breaths initially, or else for infants and children always we are giving 5 rescue breaths. So when we are giving mouth-to-mouth rescue breathings for infants, we can cover both the nose and the mouth of the infant by our mouth, and for children it is the normal way, we are only covering the mouth. Then when we are giving chest compressions for children, we are using only one hand, but number of compressions are same, speed is same, and the height 1/3 of the chest height of the child. Then when we are giving chest compression for infants, we are using only 2 fingers. Here only 1 hand, but here only 2 fingers. For adults, we use 2 hands, both hands. Then 30 compression, that is same, rate also same. Then the depth is 1/3 of the chest height of the baby. So that is also altering. Then we are going to discuss about wounds and bleeding. So there are different types of wounds here. You can see. So this is a lacerated finger, then lacerated eye, then amputated finger. It means a part is completely dissected from the body. Kala සම්පූර්ණයෙන් වෙන් වෙලා තියෙන්නේ. Puncture wound. So in puncture wound, then like embedded things, we are not going to move that object. While keeping the object immobilized, we are, do the treatments, and we have to transport the casualty keeping the object immobilized. We are not going to remove the object at any time. So here also we are not going to remove that. Then wounds, there are different disadvantages, mainly bleeding, shock, and infection. So 3 types of bleeding: arterial bleeding, that is severe and high bleeding rate as well. Then venous bleeding, slow bleeding rate, capillary bleeding. So in bleeding control, what we have to do is we have to assess the wound first. Then if there are no foreign objectives, we are applying a direct pressure. If there are any embedded objectives, then we are applying an indirect pressure. So it means both sides of, from all the sides of the embedded object, that we are applying a pressure to immobilize the object as well as to apply a direct pressure on the wound. So here what we are applying a direct pressure on the wound is to speed up the clot formation. So usually a clot is forming when there is a wound. Like that. So to speed up that natural clot formation, we are applying a direct pressure. So how we can apply a direct pressure? If it is a small wound, we can ask even the victim to press the wound by his own hand like this. Press the wound. Then if the wound is large, then we can use a piece of cloth, a folded cloth, or a folded triangular bandage to apply a direct pressure. Then what we have to do is we have to elevate above the chest level. So whether it is arm or leg, then we have to elevate above the chest level. We have to make him lie down or sit down. If it is in the leg, then definitely we have to make him lie down. The casualty, we have to lie down. Then we are applying a bandage to apply further pressure on the wound. So after applying a direct pressure with a piece of cloth or a pad, then we are applying a bandage. Then we have to observe by pressing the nails. We are calling that capillary refill check. By pressing the nails, we are checking whether the blood circulation is okay. If the nails are getting when we press, it becomes white, then we release our finger, then it becomes pink again. So if this time this happens within 1 second, so it means the circulation okay. But if it takes more than 1 second, it means the circulation is interrupted. Then we have to treat for other injuries. Then we have to treat for shock if it is present. So if there is shock, then we have to cover the person. We are discussing it later. Then there are different wounds: cut wound, penetrated chest wounds, then nose bleeding, ear bleeding, eye wounds, amputation, crush injuries. So in penetrated chest wound, actually we have to cover the chest in 3 sides, and we are letting or keep the other side open in order to help the breathing. And we have to make sure that we are turning the person into the same side of the wound. If the wound is in the left side, then we are turning the person into the left side. So that will prevent it and from the internal bleeding, that blood goes to the non-affected side as well. So if the left side is affected, we are turning him to the left side. Then if there is nose bleeding, what we have to do is we have to ask the person to breathe by mouth, then close the nose by using 2 fingers. So if the bleeding stops within few minutes, then it means it is an external nose bleeding. But if bleeding continues for even after 5-10 minutes, it means the bleeding is internal and it has probably happened in the forehead or in the head. So therefore, we can try using ice to stop that internal bleeding, indirect cooling effect by ice. But we are not keeping the ice straight away. We have to close the ice by using a polythene paper. Then again, we have to close it by using a piece of cloth. Then only we are keeping the ice. So in amputation, we are going to discuss it a bit further. So what we have to do is we have to control the bleeding, then treat the victim for shock, recover the amputated part and take it with the victim. To care for the amputated part, what is important here is there is no need to clean the amputated part, then wrap it with the polythene and then dry sterile cloth or clean cloth. So what we have to do is cover with polythene first or a shopping bag first, then cover with a piece of cloth or sterile cloth. Then we are keeping that in a container that is waterproof. We can use a plastic bag or a plastic ice cream container or container like that. Then we have to place ice on that container or plastic bag. So we are cooling the amputated or the dissected body part and taking to the hospital with the patient. But we have to make sure that we are covering the dissected body part with polythene and piece of cloth or piece of sterile gauze to avoid any direct contact with the eye. So otherwise cells will get frozen and we can't do the surgery. Then seek the medical attention immediately. Within 30 minutes is the best time, but at least within 2 hours there is a high chance of having a successful surgery. But the hospital also should have enough facilities, theaters and plastic surgeons likewise. Those facilities should be there. So therefore, take the person immediately to a, big hospital which has sufficient facilities, not to a small healthcare dispensary. Then amputation, this is what we have to do. We have to cover like this. Okay. Then for a foreign object or embedded object is there, what we have to do is we have to apply a direct pressure. So here you can see that we have used cloth ring to apply an indirect pressure. Or if you don't have a cloth ring, or if you can't prepare a cloth ring, then you can use 2 pieces of cloth, both sides of the embedded thing, and you can apply a strong bandage. So better to take crepe bandage rather than a normal bandage to apply pressure. So likewise, you have to keep the object immobilized. If the object is mobilizing, then there are further damages inside the body. So we have to make it immobilized. Then the other thing what we have to do is don't think washing when severely bleeding, then using ice, applying local medication, then applying tourniquet bandages. Tourniquet bandages or tourniquet means a very tight bandage that is applied on a wound or just above a wound to prevent any circulation further. So when that kind of bandage is applied, there is no further circulation. So due to no circulation, what will happen is the cells that are located in the peripheral, what means after the wound, is not getting sufficient oxygen and fluid. So those cells are damaged, or they will die. Therefore, we are not applying tourniquet bandages for the tight bandages, then remove foreign objects. So we have to remove foreign objects as well. So as don'ts, we are not removing the foreign objects. So this is what we have to do in shock. Shock means that we are not getting sufficient blood for the vital organs. It means the brain, then other vital organs, heart, lungs, liver, and kidneys. So what really we have to do for shock is we have to give reassurance for the person, then make the person lie down or sit down in a normal breathing, but Definitely, if in a shock, what we have to do is we have to make the person lie down. Because what we have to do is we have to really care about the blood flow towards brain and other vital organs. Then we are keep the legs elevated because 40% of the total blood volume is located below our waist. It means in our legs. So therefore, we have to elevate the legs in order to provide a good circulation towards the brain. Then treat for the cause of shock. It means if the cause is occurred by a severe bleeding, without stopping that bleeding, there is no point of continuing treatments for the shock. Therefore, what we have to do is we have to treat for the cause of the shock, and then we are continuing with the first aid. Then loosen tight clothing that will help to keep the person comfortably. Cover with the blanket that will help to prevent any heat loss from the body. The heat that is already with the body is already conserved in the body. By covering with the blanket, we have to fully cover the person with the blanket as shown in the picture. Then we are not giving anything by mouth, nil by mouth. Then wet the mouth if thirsty. If the person is asking for water, then we are not going to give anything to drink or drink. We are just only wetting the lips by using cotton or bone. Then we have to take the medical help. So this is what we have to do. Then we may have to apply medications for small wounds. So when we are applying medication for wounds, for wound dressing, first we have to clean the wound, then we have to apply the medicine, then we have to cover the wound. So for cleaning purpose, we have to use clean water, normal saline. Then as the cleaning solutions, we are using clean water and normal saline. Then surgical gloves to protect ourselves and protect casualty as well to avoid any cross infection. Then forceps to handle the gauze and cotton swab. Then cotton wool in order to clean the wound. So we can use few cotton swabs, and we can have to wet those cotton swabs with normal saline or clean water when the normal saline is not available. And we are cleaning the wound from inside to outside. Make sure that we have to clean the wound from inside to outside. And we have to clean the outside of the wound first, then middle of the wound later. So the outside area is cleaning first, then middle of the wound after that. In those two, steps, how we are cleaning from inside to outside. So at least we have to use 4 or 5 cotton swabs in cleaning a wound. Normally we are using only 1 or 2, but we have to use 4 or 5 at least. Then the medicine that are going to apply is normal saline or povidone iodine. As a brand name, it is known as betadine. So what we can use is betadine. Then cover by gauze, pair of gauze or cotton. So better to use gauze. So let's come back again to medicine. How we are using medicine is, what we have to do first is, after cleaning the wound properly, we have to use a piece of gauze that is in the similar size of the wound. Then we have to apply povidone iodine or subcomycin or betadine or subcomycin. Both are available in liquid and cream. Better to use the liquid, but cream also can be used. It will prevent any further infections if the won't get wet. But better to use liquid that will act fast. So after applying betadine or subcomycin on the gauze piece, then we can place the gauze piece on the wound. Then what we have to do is we have to take or cut another gauze piece which is larger in size than the first gauze piece. And we are keeping that gauze piece on the first one. So after placing that gauze, then we are deciding whether we are going to apply plasters or both. So first we have to apply plasters. When we are applying plasters also, we are not applying plasters all over the place. We are applying plasters just above the wound and below the wound. So the plaster should contact both the gauze as well as the skin. 50% should contact with the gauze, and the other 50%, other half is should be contact the skin. So likewise, we are applying two plasters above the wound as well as below the wound. After applying the plasters, depend on the size of the wound as well as the location of the wound, we can decide whether we are going to apply bandages or not. If it is a joint like elbow, knee, then definitely we have to apply bandage. One may better to apply one bandage. Then you can easily use a crepe bandage there, which is having a good elasticity. So we can, by using the crepe bandage, we can have a good support for the plaster. So with the plaster, we are stabilizing the dressing. Then we are giving a further stabilization with bandage. So depend on the situation, we can decide whether we are applying both. So whether we are applying plasters only, or even sometimes without plaster, we can apply only a bandage as well when the plasters are not available. Then use 5 cotton swabs as I mentioned. Don't apply dressing before arresting bleeding of the wound. Then avoid cross infection. Then seek medical help if the wound is larger or in a vital area. Okay, then scalds and burns. So there are a lot of causes for scalds and burns. Usually scalds are due to hot liquids, that is steam, then hot water, hot oil, the other thing. Then burns, the other burns are made due to the hot solids, then due to chemicals, then due to electrocution, and sometimes for extreme cold ice as well. But we are not experiencing uh, due to our climate, we are not experiencing that. So if a person is running when he is, already in fire, then what we have to do is we have to stop him, or we have to tell him to stop. Then we have to ask him to drop and roll. So this is the normal method when a person is running with fire. SDR method: stop, drop, roll. So this will minimize the contact with oxygen and help the uh, person to, get rid of the fire. Then when we are clarifying burns, there are three categories actually. Basically, we can categorize, mild burns and severe burns as two categories. But to go more deep on that, we can categorize superficial burns, partial thickness burns, then full thickness burns. So for burns, the most important first aid is flood with running water. So flood with normal running water is the most important step. So at least we have to cool with normal running water for 20 minutes, so until the pain is relieved. So it may be more than 20 minutes, but at least we have to do it for 20 minutes. Then what we have to do is gently remove non-stick jewelry and clothing. The jewelries and clothing which are not stick to the skin, we have to remove quickly, because when the skin or the area starts swelling, the objects or the jewelries and clothing are start to stick to the skin. So once they are stick to the skin, then we can't remove, because it is coming with the skin as well. Then the skin also get removed. So therefore, we have to remove quickly the non-sticking jewelry and cloth. Then as number 3, once cooled, we have to cover with the non-sticky polythene. Then after covering with the non-sticky polythene, we can apply a sterile dressing, because we can't use directly a gauze-like thing, because it will stick to the wound, because it is already heated or high temperature, the body part. Therefore, we have to use a non-sticky polythene, cover it properly to avoid any further infection. Then we can apply a sterile dressing over the polythene. then we can take the person to the hospital. So the most important thing is not taking the person to the hospital as soon as possible, but flooding the person with cool running water or normal running water as soon as possible. That is the most important thing. So please keep that in your mind that we have to prevent burn. Then seek medical advice accordingly. So don't apply creams or lotions, maybe toothpaste or any other ointments. Don't apply anything. Then burst blisters, so don't burst those blisters because that will increase the risk of infections as well as the scars will remain for long time. So sometimes even for 10-20 years, the scars will be removed. So therefore, don't burst blisters. Then don't place ice on the burn. Then you are getting the things worse. If you place ice, use only normal water. Don't use cold water, only normal water. Then remove clothing sticking to the burn. So don't remove any. And the other thing, if the burn happens due to chemicals, you are not going to apply water without knowing what is that chemical. Because there are certain chemicals which are highly reactive with water. So if we have got burned with that kind of chemical, then we are in high risk of getting the things wet. So therefore, don't apply water without knowing the chemical. If you know the chemical, then check for the label. Because in the label, or if you check from the internet, there is a particular information called medical safety data sheet, or we known as material safety data sheet, or safety data sheet. Normally it is known as MSDS or SDS. So if the data sheet is available on that particular container, or if we can obtain from internet quickly, then go through that data sheet and act what is instructed in the data sheet. So it is mentioned for ingestion, for inhalation, or for emergency contact, what we have to do. As the first aid measurement, what we have to do, it is mentioned. So therefore, please follow that if there is any chemical contamination. Otherwise, we can use water to cool the burn. Okay. Then the other topic is painting. So why we are painting? Due to the loss of oxygen supply to the brain. So it can happen due to not getting meals at right time, especially the breakfast. Then being in an exact position for a long time, especially standing for a long time, or even sitting sometimes. So when we know that we are sitting for a long time in certain functions or certain situations, so likewise we are getting pains also in the similar manner. Then if we are wearing very tight shoes, also we may get pain. Likewise, when the brain is not getting sufficient oxygen, then it's a very temporary unconscious or subconscious situation and people are getting pain. So if we identify a person is getting pain tissue, a person who has already fainted, what we have to do is we have to reassure the person. If the person is not, fallen down, what we have to do is before he falling, we have to support the person and make him lie down. So after making him lie down, then we can raise the legs above the heart level. So that is, we are trying to provide more blood towards the brain. Then check for other injuries. If the person is already fallen, then we can check for other injuries. Then we have to loose the tight cloth. It will help the person to have a comfortable breathing. Then provide good ventilation. So if it is a very confined small area, then if the doors and windows are available, we can open up them. If there is a fan, we can switch on that. If it is a very crowded area, so please ask other people to little bit be away from the person. Likewise, we have to provide a good ventilation and have a continuous monitor on the vital function, whether the person is having good pulse and whether the person is conscious and breathing or not. So we have to monitor those vital functions continuously. So after a few minutes, he will become normal. If it is a normal pain, he will become normal after a few minutes. After become normal, then we can offer hot drink to get some extra energy. A drink with sugar, then we can offer, but not a cool one or cold one, but a hot drink we should offer. But it is only after getting fully normal. While having the painting, we are not going to give anything by mouth. Can just sprinkle water on the face, or else we can just use the cotton swab and wet lips by using the cotton swab. Then this is, it's related to the poison. By inhalation, we can come across with poison by absorption through skin and eyes as well. Then by ingestion, unknown food or the foods which are allergic to us, or accidental ingestions of pesticides, then other chemicals as well. Then by injection, by intentionally drugs and other things, then sometimes unintentionally the insects and other injections. So those are the ways of people are getting poison intentionally or unintentionally. Then normal first aid procedure for these poison is remember your own safety. So we have to make sure our own safety, whether it could be a release of poisonous gas, it could be intentional poisoning as a suicide attempt. So we have to make sure that we are not contacting with that poisonous substance. While we are going to help the person, we have to make sure we are not contacting with that poisonous substance. We should wear masks or gloves or related protective equipment in order to prevent any contact. Then what we have to do is we have to check ABC. First, check whether the person is conscious or not, then whether he is breathing or not after opening the air. Then establish the cause. So we have to know what has happened, when it has happened, then how much is ingested or inhaled or how much is in the body. So if we can clearly have information on those facts, then it is very easy for us and the hospital to carry out their treatment. So if you have any evidence, the empty containers or the empty medication filled tablet, then you can take a photograph of that, or you can just collect those things and take to the hospital while you are taking the person to the hospital as well. Then it will help the medical staff to start their treatment early with the confidence. Then immobilize the casualty. You have to immobilize the casualty. Then follow MSDS if available. So as I mentioned earlier, material safety data sheet or safety data sheet, we have to, if it is available, then we can follow the guidelines or the instructions in the MSDS. Then monitor very closely. We have to monitor the person very closely because there could be sudden changes, rapid changes if the poison is spreading rapidly inside the body. Because from the outside we can't monitor that. So therefore, better to have a very close monitoring to identify any changes of the tissue. Then be ready to resist. If the person stop breathing, then be ready to give CPR. But make sure if it is by ingestion or if the poisonous material is still on the lips or near the face, don't get any contact with those materials. If you are going to give rescue breathing, you have to wear a face shield. The face shield that is you saw on the video, not the face shield. Those days we are using in order to be safe from COVID-19. That face shield or else a piece of polythene with some force, then we can use that kind of thing to avoid any direct contact, or else at least we can wear a mask. Then transport the person to the hospital as soon as possible while having a good monitoring with the vital signs. So those are the general first aid for in poisoning. Then we are going to discuss about the snake bite. So the snakes, they are having the fangs. Then we can clearly see the head of the venomous snake is different from the non-venomous snake. Usually it is pointed and they are having fangs, the venomous snake, but non-venomous snakes they don't have. So those are the highly venomous snake, land snakes in Sri Lanka. The cobra, Naja Naja, and normal name Naya, we know as. Then the common crate, Bungarus ceruleus, tail caravala. Then Bungarus thailandicus, Mudu caravala, Sri Lankan crate. Then there are two vipers, Russell's viper, Gaboya russelli, fifth polanga. Then saw-scaled viper or sand viper, it is carinatus, known as valley polanga. But there are very few deaths are reported due to these saw-scaled viper bites in recent years. But there are a lot of deaths and hospitalizations due to bites of the other four species. So those are the highly venomous snakes in Sri Lanka. Since we don't have time, we can't have a proper identification of these snakes. Then what we have to do is we have to reassure the casualty as first aider. We have to make him calm down, so that will help him to be steady, and it will reduce his heart rate as well as the rate of spreading the poison all over his body. Then immobilize immediately. So better to lift the person and carry if need any quick hospitalization. Then position the person injured part lower than the level of the heart, so that will help the person to have a good circulation, as well as to minimize the venom is spreading through blood. Then wash for 10 minutes with running water. Do not rub the wound. Do not rub the wound. Just have a smooth wash with running water over 10 minutes. Then remove clothing and wearings in the bitten area, so that will help us to have a good look for the wound, as well as it will relieve the pain of the casualty as well. Then apply a smooth bandage above the bitten side, or do not apply a bandage. So what we have to do is apply a smooth bandage. Don't apply any tight bandages to remove the, to avoid the circulation. Don't apply any tight bandages, so it will result the cell death in the peripheral or the lower area. Then transport for the medical help with no delay and minimum movements of the casualty. While reassuring, while immobilizing, we have to transport the person. Then try to identify the, not the casualty, try to identify the snake as well. Since we have mobile phones these days, we can take a photograph of the snake, but sometimes hospital is asking us to kill the snake and take it to the hospital, but that is not safe for us. So since we have mobile phones, take a good clear picture if it is possible of the snake, then we can take to the hospital that as well. Then the hospital staff can have a good understanding about the type of the snake and what the antivenom or what type of antivenom should be given, and what type of treatment should be given for the person. Then what not to do for snake bite is making unnecessary movement, giving anything from mouth, cutting or sucking the wound. Don't do any of these things. Apply any medication. So local applications there are, but since we are not aware about those things and we are not traditional Vedamahatya, we don't have that knowledge. So therefore, don't try to do any kind of thing. Then apply a tourniquet bandage or a very tight bandage. So don't apply that kind of a bandage. So therefore, these are the do not things in snake bite. Then in bandaging, actually, we are having different types of bandages, triangular bandages and roller bandages. In roller bandages, so we have normal bandages and crepe bandages as well. Then they are coming in different sizes. So we can use the large bandages to cover when there are wounds in thighs and other large areas. Then for fingers and wrist-like things, then we have to use the small or medium-sized bandages according to the size of the particular organ that is should be bandaged according to the injury. Then in triangular bandage, actually there are few main parts. Those are apex. This is the apex of the bandage, and this is the base of the bandage that is having a the lengthier side of the bandage known as the base. The corner that is just in front of that lengthier side or the base is known as the apex. The other two corners are known as just corners. Then other two sides also known as just sides. So these sides are equal in length, and this is their angle here is 90 degrees. So by cutting a piece of cloth which is 1 meter length, a square which is 1 meter length in both sides, we can just cut a half of the cloth. Then we can have a good or a proper size triangular bandage. So after cutting that, then we can have some cleaning and have a ironing also, can have a proper bandage with this piece of cloth. So better use cotton cloth or rough cloth in Sinhala we know as amuredi. So better to use cotton. Then we can have a very strong bandage. So like here we are having three different cravats here in first aid. You may know about different cravats since we are doing scouting. So this is the one fold one. Then with two folding, it is known as the broad fold bandage. We are using to immobilize fractures. Then the three folding thing also used in immobilizing fractures, which is known as the narrow fold bandage or three fold cravat. Then we are using bandages mostly in bone and soft tissue injuries, in fractures, dislocation, sprain, and not in fractures, dislocation, and sprain. So this is the fractured wrist. You can see this is swollen already, and you can see the bone that has come out from the leg with blood. This is an open fracture. This is the normal way of the knee, for the appearance of the knee, and then this is after the dislocation. Then for fractures, actually what we have to do, reassure the casualty, provide support to the injured area, expose the site of the injury, then treat any wounds, and immobilize the injured area with slings and bandages, then reassure, monitor, and seek medical help. So what really we have to do is immobilize the casualty and immobilize the fractured area, then have a proper transportation. So those are the very important things. So this is how we are going to apply an arm sling by using the triangular bandage. Unfortunately, we can't have this practical experience since we are conducting this virtually. Otherwise, we will have the practical experience of applying a bandage. Then this is also for the collarbone fracture. We are applying another arm sling like this. Then when we can't apply arm slings, then we can ask the casualty to hold the fractured hand by using the other hand like this, or else we can use the casualty's clothing in order to immobilize the fractured hand. So basically here the fracture should be in the upper arm or the lower arm, here or there. Here the fracture is in the collarbone, the bone which is connecting our collar to the shoulder. So it is connecting the chest bone and the shoulder joint. Then we have to immobilize the leg fractures as well. So usually we are immobilizing the fractured leg with the healthy leg. In between, we can, place towels or blankets in order to have a comfortable immobilization. Or else, in an absence of those materials, we can have just only the legs and bind to each other for the immobilization. Then this is how we are going to apply bandages. So here there is an order of applying bandages. First ankle, then knee, then above the wound and below the wound. So it is known as ankle, knee, upper, low. First we are immobilizing the ankle by using a three-folded bandage or narrow fold bandage. Then all other three are broad fold bandages or two-fold bandage. So we are applying one on the knee, then the other one is above the wound, the other one is below the wound. So likewise, we are immobilizing the fractured leg. Then for sprains and strains, there are muscle overstretching known as strain, and the cartilages that are connecting muscles and bones are known as ligaments. When they are overstretched or damage in the ligaments are known as sprain. So the first aid step or the procedure that we are applying here is called as rice method. So just like we are going to give rice, rest the injured part. We have to give sufficient rest for the injured part. Then we have to apply ice for 10 minutes at least. And we are applying 3 times ice with 30 minutes interval. Then we are going to give a good compression by using cloth pad. After keeping a cloth pad, then we can just bandage it with a crepe bandage. Then we have to elevate the sprained area above the heart level. So by applying ice, by giving compressions, and we are trying to minimize the internal bleeding and trying to minimize the accumulation of tissue fluid there. So it will reduce the swelling. Then by elevating above the heart level, also we are minimizing the blood supply towards that area, and it will also reduce the swelling. Then giving enough rest for that injured part is also speeding the recovery of the pain. So this is the only treatment for sprain and strain, but we have to start this first aid at least within 2 hours of the injury. So that should be keep in our mind. We have to start within 2 hours. Then the different methods of transportation. One-man transportation technique, pick a bag carry. When there are small injuries, we can transport people in one-man transportation. Cradle lift, even an unconscious casualty can be transported with the close monitoring. If the person stop breathing, then you have to keep down the person and start CPR. Then this is known as the human crutch. For small wounds, we can use this transportation method. Then different, two-handed, three-handed, and four-handed transportation. By using a chair, even we can have alternative transportation. This is known as the fore and after method, or the wheelbarrow method. In a narrow pathway, we can transport casualties by using this method, but not the spine injured people. Then this is known as the firefighters crawl method, so the fireman lifting. For an unconscious casualty, transportation method by one person, especially taking a person from upstairs to downstairs when they are unconscious. So we have to support the person like this. Then we have to slowly take the person, go under the person, and take the weight of the person on our shoulders. Then we have to firmly hold the person like this. Within 2 legs, we are placing our hands, and then we are lifting the person up. to do carry out this transportation method, actually we have to strong enough to bear that kind of weight on our shoulders. And we have to really careful about our back as well. So we have to prevent any back injuries, spinal injuries for ourselves as well. Then this is known as three-man lifting. Especially a person with leg fracture, we can after immobilization, we can take the person onto the knees of the people who are knee down on the floor. The fourth one is only supporting the other. Then after keeping the person like this, just turning to the their side or the three people side, then lifting slow. Then in any spinal injuries, we have to use the spine board. So there are spine boards which are having the collar support to avoid any head movements as well. Or if the collar support or the head support is not there, then we can have an alternative support created by us. And what we have to do is we have to just, tight the person with the belt available in the spine board. If the spine board is not available, what we can do is we can use a firm wood material, plywood like thing, then transport the stuff. So this is the way of carrying a person with a stretcher. So usually we are carrying the person with legs first, then the head after. Likewise, four-man transporting method with stretcher. So these are the equipments that should be included in the first aid box. Different bandages, then different plasters, then the items that we have discussed in wound dressing. Apart from that, thermometer, then Jeevani like rehydration thing, water bottle, then iPad to cover the eyes, then eye washing liquid we can keep, then any antiseptic solutions can be keep, then face mask should be kept according to these days. Likewise, we have different kind of list. You can take a screenshot of the list and have the list. This is according to the factory ordinance of Sri Lanka. What should be kept in industrial level first aid box, but in our home level, we can keep even Siddhalepa, dry water, those things as well. Right. So we have already covered the area that we are supposed to cover. So since the time was very short, then I have to go through some topics. So if there are any questions, then now we can discuss those questions as well. Hello.
Thank you, sir, for delivering such a remarkable session on first aid. I hope all the participants could gain better knowledge regarding basic first aid procedures. Beforehand, we move on to the Q&A session. Just a reminder for all the participants, we are providing an e-certificate for you. So to become eligible for the certificate, please fill the Google form, which is posted in the chat box. To continue with the Q&A session, now I would cordially invite Harshani to take over.
Thank you, Nadun. We have received a number of questions through the Slido link. And little reminder before proceeding, if there are any other queries regarding the content of today's webinar, please post them on the Slido link provided in the chat. Sir, first question is, how can we become a qualified first aider? Who has to give that certificate?
So to become a qualified first aider, actually you can undergo the basic first aid training that is conducted by the Sri Lanka Red-Cross as well. So it is a 3-day course which is having the full practical sessions and the theoretical sessions. So after being qualified or undergoing that training, so you will have to face to an examination as well. So which contains both theoretical questions, examination paper, and practical exam, practical questions as well. So when you pass that both exams, then you can become a qualified first aider with Sri Lanka Red-Cross Society.
Thank you, sir. Next question is, are there any adverse effect when performing CPR?
Adverse effects, yeah. It means I think that the person is asking whether there are unwanted things can be happen for the victim. So where we are actually giving CPR for a non-breathing patient. So if the person is not breathing for 5 to 10 minutes, then definitely he will die. So there could be some rib fracture and worsening of the wounds if there are any wounds in the chest, especially. So there could be, those kind of situations. But irrespective of those minor situations, the stopping breathing is a very severe one. So if the breathing stop continuous for a long time, then the person is already dead. So therefore, irrespective of those adverse effects, what we are considering is the benefit over the risk. So if the benefit is higher than the risk, then definitely we are conducting CPR. Even for pregnant mothers, if they stop breathing, we have to give CPR. So there are adverse effects, but since the benefits are higher than that, we have to give CPR in all situations for a non-breathing patient.
Thank you, sir. Next question is, there has been an accident in our workplace with 4 people injured. Which person do I assess first?
So if there are 4 or 5 people, as we discussed earlier, depend on the severity, we have to give the priority. So if there are any, so usually we have 2 categories. Those are, shouting with pain, or those are silent. So for the people who are with no sound or no any movement, we have to attend first. So that is one. So out of those silent people also, we can find different categories. So I would like to prioritize the non-breathing casualties first. Then if there are any casualties with severe bleeding as the second phase, then third phase, people who are unconscious, who are not conscious. Then as the fourth place, people who are poisoned, and fifth place, people who have severe burn. So that is the priority we have to give according to the severity of the illness.
Thank you, sir. Next question is, when chemicals splash into the eyes, how long should we flush them with clean water?
Yes, good question. Actually, we have to flush at least for 10 minutes. So make sure when we are flushing, so ask the person to, little bit bent to that side. So if the splash is already gone to the left side, so we have to bend towards the left side and do the flushing. So we have to ask the person to bend towards left, then we can do the flushing very gently, but at least 10 minutes we have to do.
Thank you, sir. Next question is, what is the best way to check patient circulation?
Okay. So since actually we had a very limited time, actually I have to run through the session. So there are 3 ways of checking the pulse of the casualties. So that is capillary, that is carotid pulse. So near the neck, under our jaw, we can check carotid pulse. Then near the wrist, so we can check this pulse here. This is known as the
Radial pulse.
So apart from those carotid pulse and the arterial pulse, so we are checking the brachial pulse. So that is mainly on the infant. So it is located in the muscle here. Since when we become young and become older, so muscles are expanding, so we can't feel that. So that pulse is not significant there. So always better to check the carotid pulse because it always indicated the, circulation towards brain.
Thank you, sir. Last question. A possible brain damage might happen. How long after patient stops breathing?
So in a brain damage, actually, so not due to a brain damage, usually the breathing stops, but it happens. So after breathing stops, then usually brain damage happens. So if we say in an accident, if a person hit by a strong shot, then there could be brain damage before arresting breathing. In that case, within even 5 minutes, breathing may stop. Because if the brain really can't control breathing, that so otherwise, if the breathing control part is not affected in the brain, so the breathing won't affect. So in that case, if the breathing controlling area is not damaged in the brain, so breathing will continue. It won't stop. So if that area is affected, then breathing will stop even after 1 minute time, sometimes. Or else gradually it will stop within 4-5 minutes.
Thank you, sir, for answering the questions. And over to you, Nandu.
Thank you, Harshini. Now we have come to the end of today's webinar. In order to deliver the word of thanks, I would cordially invite Asini.
Good evening, everyone. I consider it as my pleasure and honor to deliver the vote of thanks on behalf of you. First of all, I would like to pay my gratitude to today's speaker, Mr. Yasantha Lokuhelapitiya, Senior First-Aid Instructor of Sri Lanka Red-Cross Society, who duly accepted our invitation and delivered a remarkable session. Then I especially thank Mr. Sri Lanka Silva, Assistant Chief Commissioner, Rover and IT of Sri Lanka Scouts Association, as well as Dr. Sankeryava, National Headquarters Commissioner, who was the founder Rover Scout Master of Ethugalpura Pioneers District Rover Crew. I also thank the District Commissioner of Kurunegala District Scout Association, Mr. U.B. Disanayaka, and Assistant District Commissioner Rovers, Mr. Kulatilaka Vijayasundara, for their well wishes. I convey my gratitude to Rover Scout Master of Ethugalpura Pioneers District Rover Crew, Mr. Chanaka Halagolla, as well as Rover Scout Mistress of Ethugalpura Pioneers Girls District Rover Crew, Mrs. E.W. Aryamala, for your guidance and support provided for us in organizing this webinar. Also, I'd like to thank my dear fellow Rover Scouts of Ethugalpura Pioneers District Rover Crew who were behind the scenes. Your courage and dedication contributed a lot to make this webinar a success. Finally, I'd like to thank all the participants who joined with us today and hope your participation for the future webinars as well. Thank you, and over to you, Nadu.
Thank you, Asini. Before we wind up, I'd like to request all the participants to turn on your videos for a while to keep a record of the day.
And I would like to thank all the participants for their patient listening. And I hope you have gained some kind of knowledge on first aid. You will use that first aid for your career as well as to help anyone who needs your support at an emergency or sudden need. And I would like to give my gratitude as well as best wishes for your future endeavors as well.
Thank you very much. So that brings the end of today's webinar. Before we wind up, I'd like to invite you to join with us for our future sessions as well. To get more updated about our future webinars, please follow our Facebook page. So that is the end of today's session. Thank you for joining. Stay safe, stay healthy. Happy scouting. Good night.